Heat illnesses are seen very often. It's a very common illness, especially in the summer months and in the Maryland area. We see it not for heat illnesses, but for the symptoms that bring patients in. There are several symptoms and signs of heat exhaustion that you'll want to keep an eye out for. Sometimes it's just the feeling of not feeling right, feeling ill, fatigue, malaise. Along with that can cause a fast heart rate, feelings of thirst or dehydration, and lack of urine output. People in general just aren't feeling well and may have like a headache. The best way to deal with heat stroke is to prevent it. So if you can prevent being exposed to such heat extremes or heat levels, that's best. So some of the recommendations that we as physicians give is to avoid being out when the sun is the most intense, hours from about 11 to 4 p.m. And if you do, make sure you're drinking a lot of fluids to stay hydrated. We see a heat exhaustion in our clinic, and it tends to be the extremes in age, both the very young and the elderly population, who may not know the signs or symptoms to look for and may progress further than a healthy adult who could monitor the symptoms. I had someone ask me if when you pull on your skin you can tell if you're dehydrated or not. That was something I actually picked up in training as well, almost what we call a poor man's test, a quick diagnostic view to know. And your skin, when it's very well hydrated, will be able to resiliate or become normal after you've extended it or pulled it up. If you are pulling up your skin and you notice they stick together, it doesn't come back to normal, that could be a sign of dehydration. Those cells are thirsty and they're just sticking together.